The eCancer editors wanted to highlight 3 news items for this month, September. The first is that Paclitaxel in the form of a bound albumin protein formulation has been approved by the FDA in combination with gemcitabine for the treatment of advanced pancreatic cancer. This is one of the first steps forward in the treatment of this disease in a long time, but it's a very small step. Difference in overall survival between Paclitaxel plus gemcitabine versus gemcitabine alone was a couple of months, from about 6 months to about 8 months. However, meaningful step forward. The second item of news we wanted to highlight was the sad death of a very, very vigorous campaigner, a cancer advocate, particularly for melanoma. Patricia Garcia Prieto had metastatic melanoma, and the last 2 years of her life were spent in pulling together the various advocates for melanoma in the European area. She set up an independent melanoma community-based group, and she put a lot of pressure in the European Parliament on the lawmakers to organise a number of issues which were holding back the treatment of melanoma patients. Particularly, she was concerned about cross-border access to new treatments. There have been several new treatments in melanoma, as you know, and she was in a country where she could not get any of them. And her system for paying for medical care refused to pay for her to cross 3 kilometres from her house to another country where this was available. And the last item of news we thought was worth highlighting was an annual report from Marge Foti, the Chief Executive of AACR, and she was summing up the good news and the impact that cancer research has made over the last decade. They noted in their report that in the American data there are now 13.7 million cancer survivors as of December 2012. And they also pointed out that looking at the statistics from 1991 up to the present, there had been 1 million less deaths in men, and from 1992 to the present, there were 1 million less deaths in women. So good news from the AACR. They remarked on passing that as an obvious evidence that research was working. There were 11 new drugs approved by the FDA last year for cancer. There were 3 drugs which are in existence approved for new applications, and there were 3 new technologies approved.